So, we're going to look at prepared questions in just a second, but real quick, I did want to mention some aspects of the PHR, the personal health record. So, the way that the PHR works is that, this is the sign-in screen. I'm just going to kind of give you a brief overview of it. The PHR, I think, is going to be specifically useful for your specialties. This is an ability to share medical information, chart information, with the patient securely. And of course, they've got a nice login screen to be able to access that. They go to patientfusion.com. They have access to that information. Now again, this information though is still really your information. It's secured by you. So you need to give access to the patient for the PHR. It's not just right off the bat. It is something that you grant them access to. Now, right now, the way people think of PHRs is they think of it specifically as just personal health record. And again, here's kind of the email that they're sent. Personal health record. What that means, of course, is a record of your medical information. And I'm really excited for this personally because, I ride my bike around town. Every once in a while, I scrape my knee. I have to get a tetanus shot. And they say, when was the last time you got a tetanus shot? Or I go to a chiropractor and I say, it's been a while since my last adjustment. And he goes, well, when was your last adjustment? And I say, oh boy, how do I know that kind of stuff, right? With the PHR, I'm a more informed patient. I have an idea of when I've had visits with my provider, which will then make it easier for me to maintain my own health, I mean, if I remember exactly when the last time I had this visit was, I can make sure I'm a little more in tune with what the provider wants me doing on my own time, how he or she wants me to be eating, sleeping, maintaining my health. Also at the same time, the second you update the medical information on Practice Fusion, that information is automatically transferred over to the patient portal. So it is real time. It is this is just showing you how they log in. It is real time. It is secure. And moving forward, the way that the PHR really is meant to work in its next, more advanced level, this is where it gets really exciting, is as a direct portal with you. And as we talked about, communication directly, rescheduling appointments, asking questions, perhaps also in the future, web meetings, so you can do some telemedicine. This is a direct connection between you and the patient from any internet-ready location, and the possibilities are really outstanding with this. So this is something also that the government is focusing on, which is useful for everyone, because if the government is focusing more on personal health information, then that means the technology in all fronts is going to be moving in that direction. Right now, the point of health information technology is not only to allocate resources for you to be more available for the patient, but to also have more informed patients themselves to, again, take care of their own health.
Does that mean that patients can access their own file, their own medical record?
Absolutely, absolutely. Now, that would be specific aspects of it that you allow. Now, this is up to you.
That's very much of a double-edged sword.
Psychiatrists don't allow it.
Yeah. So
right.
Don't allow it. But
it's what you allow them to see. So let's say you only want to share with them particular information, plan information, stuff like that. Visit types. You can share just that information. It's not a complete open access to everything you've done because, as you said, I mean, even psychologists might not want all the information available. And this is not available right off the bat. This is something that you grant access to or don't grant access to. It really is up to you. I mean, the way we look at it is the information is available. It's transferable. If you feel that it would be better for the patient to have, then you have that ability to do. Of course,
patients also do have a right to their medical records. I mean, patients can come to this school and request in writing, and we have to give them their whole chart, regardless of what we write. So I'm wondering what the right will be for a patient to access electronic records.
Would you have to keep a little tablet still with your own private notes or a file of your private notes that you want?
Yeah, exactly.
Right, and I mean, it is kind of, the information that you basically want to provide for them. So, like I said before, when was the last time I got a tetanus shot? When was the last time I had an adjustment? Things like that, just to get a better idea of my relationship with the provider as a patient. And then moving forward, really just making it a portal to connect the two of you, to be able to reschedule appointments, ask questions. Of course, this is all monitored by you as the provider. This is in your own hands because there is some information that you necessarily might not put in there. But as you see, appointments, perhaps diagnoses, medications, immunizations. But again, this is up to you, whether or not this is the information that would be applicable for the patient to have. Perhaps you might just decide to print out the plan section. That might just be what you want to do.
Just like in Europe. In Europe, it's amazing that on information, they just everything right there on the computer and less paperwork and information go faster.
Absolutely. And then if you think about, this kind of brings you towards the future of EHR technology. Something that, the way that this will move in the future is as this information is put in a digital format, is collected for people. Of course, legality is always going to be the first concern, but let's say down the line, my grandkids might be able to have a better understanding of what they're susceptible to based on the information I've input electronically myself and that my future generations. You have this great reporting ability to say, I understand, or even, doing research, you say, wow, my patients in this town have, over the course of years, been presenting this particular ailment. What does that mean to me? When this information is located, in the cloud, accessible, it's digital, it's reportable, that's the kind of information that you're going to be able to glean from it moving forward.
Can you set up outcomes like for each visit, or
I'm sorry.
outcomes like this patient's elbow got better?
Oh yes, absolutely.
I mean, you can actually track that data.
Absolutely.
Which is great for
Such
grant,
as
grant writing.
On a scale of 1 to
Yeah.
8, to on a scale of 1 to 10, how's your elbow this treatment? Versus
Absolutely.
the
Or
next
yes or
treatment,
no,
or-
this treatment, you feel better after this treatment.
These are
yes
all
or
the-
no, and then you do
yeah.
the scale.
So you
These are
start-
all the reporting features that we are definitely always vigorously developing.
Yeah.
Now, you will soon be seeing also more images involved, things like that, but graphs, things like that, all that sort. We are going to be implementing some API and sandbox features to get other third-party developers to come up with stuff.
Graphic, that's wonderful. Another one that I want to see diagnosis code. I know we have CPT, this is a treatment code.
Right.
I don't know, it's like for example, trapeziums, sprain, cervical sprain, stuff like that. So they have a CD9 code. I know it will be very convenient. Sometimes you have to go online. So what does that mean?
Absolutely, and we do have. We're actually using. Joe, have we implemented ICD-10?
Not yet.
Not yet. So we do have complete ICD-9 codes in there.
Okay.
And we're actually moving forward to even ICD-10, which is not currently being used in the States, but is something that we want to be, progressive about. But yes, ICD-9 codes,
Yeah,
absolutely.
because that's for billing, they're always looking at that part.
No, you could also set it up so that we would only choose the ICD-9 codes that they pay for acupuncture.
And same with workers' comp. and-
Same
That's
thing with
right,
the workers'
that's
comp
what I
codes
mean.
and stuff, yeah.
And this is also
So we're
all
quite
editable.
limited in what we get reimbursed for.
But this is why we want to make it very editable. So you can add
Yeah.
modifiers, you
Yeah.
can add whatever you want in there to make sure that it's specific to how you do billing, how you do coding. The codes are just a matter of us adding, information to our databases, which is easy for us to do. And again, you don't have to, let's say we upload a new set of diagnoses, you don't have to download anything. You just log in, it's already there. So this is a major advantage of the web-based model. And time saving is why we're here in part of the first place. I mean, what you're good at needs to be focused on. It needs to be talking to the patient. It needs to be doing this. We don't want to waste your time learning how to use an electronic system because that's not why you got into helping patients. It wasn't to be doing IT work, which is why we've made it very intuitive. We provide support with just minimal training. This will be the tools that will allocate more time. So, again, I've been very happy that we're coming up with these questions. I mean, this has been really, I'm glad